This is Dr. Ryan Bell again with YADAYADA Pediatrics. Let's talk about your infant's 6-month well checkup. So again, following some of the earlier themes with earlier visits, vaccination is important at this point. So usually the third set of shots usually involves 3 shots and a liquid rota vaccine. We're watching growth very closely, see what changes we've had from that 4-month mark. We want to get a good feeding history, make sure your baby's making some progress there. If you haven't started baby foods at this point, then we'll really encourage starting to do baby foods at the 6-month visit. And then overall development with these babies, things that are important at this point. Babies should be getting close to sitting up. They should have a little better trunk control at this point. Should be rolling, maybe even starting to scoot a little bit with their arms, getting to where they're mobile. So that's an important thing we're watching for. As far as foods go, so definitely we're wanting to do some peanut butter at this point if we didn't start that at the 4-month visit. Baby foods including fruits, vegetables, starchy foods. Babies can start to grab little things, little puffs or Cheerios, little pieces of bread. So those are all things that you're looking for. Kind of that practice with their motor skills is a good thing developmentally. Babies also tend to get their first teeth between 4 and 6 months. So we're looking at their gums, seeing if there's teeth there. If teeth are coming in, we'd say go ahead and start cleaning them off good at night, either with a little toothbrush or even just a washcloth works good to start. But getting in that habit of cleaning the sugar off their teeth before they go to sleep at night, and hopefully even once or twice during the day. If you live in an area that does not have fluoride in the water, the dentists encourage that we start kids on a small dose of a fluoride supplement at around 6 months, even if teeth aren't in yet. And so we'll often send in a prescription for fluoride because we don't have fluoride in the water here in our area. Babies are okay to do ibuprofen now in addition to Tylenol. So up until 6 months, we like to just use Tylenol if there's concerns for pain or if they had a fever, especially after getting shots. So ibuprofen becomes, in my mind, the most helpful thing for most of those issues. Anywhere there's inflammation, that ibuprofen is going to be more helpful for your baby. You can do those doses every 6 to 8 hours with ibuprofen, where Tylenol is only every 4 hours. So especially at night, if your baby's teething, that's when they're most sensitive to teething pain. If you can give them a dose of ibuprofen at night, that will usually help quite a bit through the night and help them stay asleep and get the rest they need. And that, in a nutshell, is your 6-month well check. Hope to see you then. Thanks.